I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebo, Gyno and Beyond. I got two Gynecomastia gland. I've got two Gynecomastia gland removal cases today. The first one, 35-year-old gentleman from Connecticut who presents with, just gynecomastia. Again, he's lean, very lean, body fat in the single digits, and all he's got is glands. I use these nipple coverings now because the social media doesn't like nipples, but you can kind of see this ball there. And this one is very tender, very, very tender right there. And he's very lean. Make a little incision where the water meets the beach, just under the areola, and get the gland out. This one is there, but it's very, very small. Again, the same incision, a little bit smaller on this side, and just get that gland out. Both of them 100% to perfection, no chance of them growing back whatsoever. Again, under local anesthesia, and to perfection. So if you have gynecomastia, you call Lebo, who does it right, does it perfectly. This gentleman, just gland, no lipo. If someone would do lipo on this gentleman, would be just a sin. Really just doesn't need. His body fat is, again, single digits. Under local anesthesia, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go. That, median like that. That's where the glands are, the pec muscle like that. Glands right there. Pec muscle just like that. The extent of the local, kind of just like that. A little bit more local on this side, pretty much just like that. And then the extent of the incision, very small. And these will be all self-absorbing stitches. Lift up this side again, right there. Perfect. And you can see this puffiness and the gland right in there perfectly. Again, no fat. All right, let's go to the OR.
Hello, let us begin by introducing ourselves. I am Hans.
I'm Franz.
And we want to pump you up.
We pump you up. Here we are. This is the smaller side. Make an incision where the water meets the beach, very gently. Got to be careful making it on the lateral part, because with the arm movement, that's the part that stretches a little bit. So I limit my incision on the lateral part. I don't like stretching. So I'll go down the surface of the gland. Remember, glands are white, fat is yellow. Nice. Beautiful. You all right? Mm-hmm. Underneath the nipple. Don't make it too thin, but make sure that you get all the gland out. Perfect. Alrighty. Lift up that arm just a little bit. Right now. Let's see where the gland is versus fat. skin from it. Centered at the nipple. Beautiful. Now grab the white stuff right there. You can see it. And just very gently just get the gland out. The beauty of local, it's, as I explained to this gentleman, it hydro dissects the gland, so it's all dissected from the local, from the water. Nice. Make sure you don't gouge any of the natural anatomy, the natural fat, the muscle, of course, and the muscle fascia. Just make sure you don't over-resect. That's when you have trouble. It's beautiful.
How big is this one?
I'm going to show it to you in a minute. Then we'll compare this one with the bigger one on the other side. There you go. So that's this side. We're going to look in there. We're going to make sure that everything's perfect. Side's a little bit bigger. The gland, I mean. Incision about the same, maybe a little smaller. Let's see how this one looks.
This one branches out in different directions
Yep.
too.
We're gonna make sure it's all out.
Living with this for so many years, I was just gonna leave it, but it's just so painful.
Yeah, it's just hard.
The other day I was doing something on housework and I laid on it and it was just awful. It just hurt.
See the difference with the tranexamic acid, let me tell you.
Alright.
A little bit, don't worry about it.
I would have taken it, it just, my stomach's really bad.
I got it, don't worry about it, I'll deal with it. I'll make sure everything's perfect. Alrighty. Now, that's the white, the beauty of what I do. Good.
So you have had some diarrhea and the vitamins that I've been taking.
Really?
The ones you prescribed, yeah.
All right, now.
What you normally see, would you say this is like average size, small, big?
Well, that's with small, from what I do. This side, I'm gonna let you know once I get around it. So this case is going to be a little bit more bloody because he couldn't take the tranexamic acid. But I added just more of TXA, the tranexamic acid, into the local. So it'll be no problem. It will be no problem. There we go. Perfect. Not in pieces, just one piece. So you know you got it out. And as I can tell, it's inflamed. It's painful to tender and it's stuck. The ones that are inflamed are usually more stuck. Here we go.
It hurts a ton when you finally do it.
Yeah.
It's been about a year of constant pain. I'm even running now. When I run, it just, the impact of running, it just hurt it. I'm just like, I can't do it.
You're almost there.
It's not worth it.
That's beautiful.
Mm-hmm. Yes, that one is big on the right side.
I feel like I'm in like the 6 o'clock position, started like going down more. Just like,
Now this is perfect. Coming out. There you go. Perfect. That's the undersurface. That's the lower surface.
Beautiful.
Perfect. Good. All right. So I flip the nip. So I get in there, I flip it, and I can see a little chunk of gland right underneath there. You don't want to thin it out too much, but you want to smoothen it so when it heals, it lays flat. That's all, really. Beautiful. Done. Alrighty, Dr. Lebo, Gyno and Beyond, 35-year-old gentleman from Connecticut, where we did bilateral gynecomastia gland removal, local anesthesia, stealth incisions, right at the inferior aspect of the areola. I've got some antibiotic gauze on there just to cover the incision and the areola because Instagram doesn't like nipples to be shown for now. But look at the nice, great volume of his chest. Make a muscle there. See, no concavity, no indentation, perfect shape and contour to his chest itself. Here are the glands that we got out. The left side was literally, 4, 5, 6, 7 times bigger than the right side. He just wanted both out because he is on TRT and he just doesn't want them to rear its evil head. This one was the left side was very, very painful. The right side, not so much. So this one probably has some inflammatory component, and it was hard getting out, very like rock, like a cement. So we're going to biopsy these just to make sure, but they look absolutely benign to me. Again, local anesthesia, stealth incision, perfect results, no concavity, no indentation, no deformity at all with me, and that is guaranteed. So if you have gynecomastia, you call me, Dr. Lebo Gyno. And oh, by the way, he consulted many, many doctors before choosing me. And he chose right. He chose wisely, as they say in The Last Crusade or whatever it was. He chose wisely. So Dr. Lebo Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.